Hello. In this brief series of slides, we'll discuss the concept again of asking clinical questions and how to approach answering them in a systematic, orderly fashion. To review, there's a general sequence in the process of evidence-based practice, especially in asking clinical questions. First, we always want to acknowledge if there's something that we don't know or understand. From that point, we want to make sure that we formulate a clinical question, and we've talked about in this class using a PICO format for that. Once you generate that PICO question, the next step would be to efficiently search online databases and then selecting the best available evidence based upon your search. We've also talked about how to critically appraise the evidence, and then finally integrating evidence into your clinical practice will be key to ensuring that you're practicing in an evidence-based fashion. And you're always evaluating yourself to determine how well you're doing as an evidence-based practitioner. We mentioned in the last slide that it is important to acknowledge areas of practice that we have trouble understanding, or are there things that we just don't know? This is commonly where clinical questions come from. Other areas that clinical questions come from are commonly professional practice, professional trends including hot topics, existing published research, and the questions that are generated from that, as well as existing theory. And the clinical questions that we develop usually come from the four domains that we see in evidence-based practice, including diagnosis, prognosis, therapy, and harm. Take a minute and just review this slide for the different definitions for each of these four domains of practice. To review, when asking or develop clinical questions, one strategy that can be used is the PICO or PICO format in developing a question. The PICO format includes identifying who the patient population or the problem and what those particular aspects are, what the interventions are that you're interested in studying, if there's a comparison intervention that you're interested in assessing, and then finally the outcome. And it's perfectly fair as well to have a patient concern, have an intervention, and be interested in assessing outcome. There may not always be a comparison intervention. That's going to be dependent upon your particular question. Nonetheless, the questions that we develop should be relevant, direct, clear, and focused. Here's an example of a clinical question. Your patient is a 68-year-old woman who you are treating for general deconditioning. She notes that she has had some difficulty with balance lately, and she is concerned over her fall risk. She asks you if Tai Chi exercise training would be helpful in reducing her fall risk. There are likely many different methods and strategies to try and answer the question that we just posed in the last slide. For this particular exercise, though, I would ask you to take, it's about 10 minutes, to listen to the 3 videos below. All of these are from the Center for Evidence-Based Medicine, and they really deal with formulating a PICO question and then using that PICO question through a PubMed search engine in really trying to assess the critical or the clinical evidence that we come up with through that search. So I would ask you to review the 3 short videos and then generate a PICO question for the patient in the last case. And then go ahead and take a moment and search the literature and see what you come up with. See if you can come up with an answer for whether or not Tai Chi exercise would be effective in decreasing fall risk in an elderly individual. So before we talk about the search strategies that you may potentially use to answer our clinical question, let's just talk about the PICO format. So for this particular question, the P would relate to older women with general conditioning. The I would relate to Tai Chi exercise training. There really is no comparison intervention at this point, so we wouldn't really need to include that. And for the O, or the outcome, we want to know, does this particular approach, Tai Chi exercise training, reduce fall risk in elderly women? And once we have that PICO format, we can finally develop our clinical question. For an older woman with general deconditioning, is Tai Chi exercise training more effective than no intervention for reducing fall risk? So here are the results from my search of PubMed. My search terms were elderly and Tai Chi and fall risk. I also checked, with respect to article types in the upper left-hand portion of the screen, clinical trial and review. I kept the text availability open as well as the publication dates. I didn't customize those. And my results yielded 18 items, which is a reasonable number to search through. If you look at that box for best matches, the first one that pops up there is a systematic review and meta-analysis on the effect of Tai Chi in reducing the risk of falling. And as we know, systematic reviews and meta-analyses would be the highest level of evidence. So that would definitely be a paper that I would want to take a look at that would likely help me answer my clinical question. It's always a bit of a challenge trying to find the full access version of the paper that we're looking for. In this particular case, I went to a website called Sci-Hub, which is a website that really provides a fair number of full access texts for papers that we may be looking at. So I went to Sci-Hub, I placed the title of the paper into the text box, and I hit open. And then the next slide shows you what that paper would look like on that particular website. Here's the paper on Sci-Hub, and the next slide will show us the abstract for the paper, which may give us at least some understanding of the results. So just in reviewing the abstract, it's apparent that Tai Chi may be more effective than other measures, as well as no interventions for fall prevention in at-risk elderly populations. Going back to my list, that I had developed from my search terms. There was one other paper that I found, and it dealt with a Cochrane database systematic review. The Cochrane collaboration is essentially the gold standard for determining whether or not interventions are effective. They're a group who performs systematic reviews and meta-analyses for a wide range of interventions. And in this particular case, they concluded that Tai Chi, again, was effective in reducing fall risks in at-risk community dwelling older folks. So it's always nice to have at least two sources that really help you answer your clinical question. So in this particular case, we would conclude that yes, Tai Chi is effective in reducing falls in community dwelling older individuals. So now that we have our answer that Tai Chi may in fact be effective, there's a couple of considerations here before we can really jump forward with determining how would we best intervene with this particular patient. For example, we're going to have to consider the dosing, the frequency, and the intensity of the exercise program for this particular patient. There are several factors that really play into this, especially if this person is a novice with exercise strategies. We'd also want to know how long before we see a decrease in fall risk. And these types of questions are likely not going to come from a systematic review or a meta-analysis. Rather, we may have to get into a randomized controlled trial or potentially even a nice case report to really gain an understanding of how best to dose these particular exercise strategies and how long before we're going to actually see a decreased fall risk. So with respect to answering the question, systematic reviews and meta-analyses are quite beneficial, but to really get into the specifics of the exercise program and determine how long it's going to take for changes to take place in the person's fall risk, we may have to go to lower levels of evidence to get more information on treatment planning and implementation. So in this particular example, we used electronic bibliographic database searches to really help us understand this particular clinical question. But understand there are other information sources as well. Textbooks, while sometimes outdated, can still have a wealth of information and can serve as a nice starting point. There's also non-peer-reviewed journals and professional magazines that sometimes cover some of the hot topics in the career field. And of course, there's peer-reviewed journals that really serve to help us have a central point to really determine where these papers are housed. So in the case of the first systematic review and meta-analyses, that's from a peer-reviewed publication. That would be a journal that we could then go to get the full text and really determine whether or not that intervention is going to be effective or not. So multiple sources of information all have different levels of usefulness, but I think for the purposes that we're talking about here, peer-reviewed journals through electronic bibliographic database searches are probably our best bet. And here is a list of electronic bibliographic databases. At the top is Medline and PubMed, and the tutorial we use today came from that. But there are several others that you can potentially use as well that can provide a wealth of very, very valuable information. As was mentioned in the videos from the Center for Evidence-Based Medicine that you listened to, there are several tutorials available, some through PubMed, some through Medline and Ovid, some on Mesh, and different search strategies. But the bottom line is that there are several different tutorials available for you to help you search the evidence. I thank you for your attention, and this concludes our presentation.